we have had a leg wound that then ends up in an amputation because that leg wound was left. Common signs with a wound that's going south, redness around the area, oozing from the wound, and that could be either blood oozing, a serous clear ooze, or even a pus ooze. Also, if there is any strange odor coming from the wound, so any bad smells, weird smells, anything like that, it's not normal and should be investigated. If any of those things are left and not seen to, we could be going down a really nasty path for that wound, and the sooner it is picked up and sorted out, the better and quicker the recovery is.
Welcome back to the Paws and Effect podcast. I'm your host, Dr. Cara, and I'm thrilled to be sitting down again with the wonderful Sister Cat, an exceptional veterinary nurse with years and years of experience. In the past, we've had insightful conversations about pet obesity and deeply emotional topics like euthanasia. But today, we're turning to something very practical, post-op care. From wound management to nutrition, rest, and why these follow-up appointments matter, Sister Cat will guide us through the best practices for helping your pet heal safely and comfortably after surgery. Welcome back, Sister Cat.
Thank you for having me again.
Yay. If for those of you who don't recognize Sister Cat, she does change her hair color.
Chameleon.
We love it. Every now and again I walk in and I'm like, where is she? Into the practice. And it's like, it's me.
Yeah.
Welcome back.
Thank you.
So we've had some discussion on euthanasia historically. We've discussed obesity in our pets. And I am delighted you have our new cat, our practice cat in your arms.
Yeah.
So that's quite a privilege.
Very sweet
We're going to try not
Maine
get
kitten.
distracted. She's behaving really
Having a
nicely.
snooze. Yeah.
And we are podcasting from Hillcrest Veterinary Hospital, which is our
Very
practice.
exciting. Yeah.
Yes, in our new podcast room, which is ever evolving. We do need a little bit more sound dampening in here, but it's so
lovely.
nice to be home. And we've set up a luxury cattery.
Oh, and it is exquisite. Absolutely exquisite.
Yeah. So we are quite
Looking forward
cat
to that.
obsessed, but generally animal obsessed.
Yes.
And so we were talking about what would be informative for owners. And one of the things that I hear you advise a lot on, obviously with your role as our nurse, is post-operative care for our pets.
Yeah.
And I find that there is real important communication that happens between you and the owner. And I thought it would be a great thing for us to share with the listeners, because if you get it wrong, it goes south quite quickly.
Yeah. And kind of drastic consequences.
Yeah. So I'm going to ask you some of the things that I mentally feel are really important. And then perhaps, if I leave anything out, please, discuss the things that I miss. But I think let's start with the obvious sort of opening things. We're talking anything that is discharged from a hospital, whether it's had some sort of surgical procedure, whether it's elective, meaning that we've planned for it, a spay or neuter, or even a lump removal.
Yes.
It's been an emergency type situation, a fight wound or amputation or whatever it may be. It's pinning. Or if they're being discharged because they've not been well and they're going home now.
Yeah.
The important thing is communicating with the owner as to managing things or signs that they probably need to return.
Yes.
So how do you tackle it? I mean, we do have some instructions that you hand out physically, but what is your general approach in terms of, you can give us a case example if you want.
Yeah. So, we do always send written discharge instructions home with a client, but there's also, it's more in depth, that for example's sake, if we're sending a spay home, the standard instructions are, minimize activity, keep an eye on the suture site, look for any redness, any odor, any oozing, anything like that. But those sort of set of instructions are very basic and we need to go a bit more broad spectrum. So we actually discuss everything with the client when we're discharging the pet. So for example's sake, with the spay, so when we're saying minimize activity, we often still get clients asking, well, can I still take my dog on a 5K walk? We won't run the dog, but we'll take it for a walk. No. We sort of, think of yourself being discharged from hospital after a major surgery.
Can't drive for so many
Yeah,
weeks.
I mean, for us having a hysterectomy at 6 weeks, don't do anything, don't even turn the kettle on.
Yeah.
So we do need to try and sort of explain that to the clients as well, that it is a big surgery. So yes, it's a very common surgery, but it is still a very large surgery for a dog to go through. So the dog's activity levels need to be kept to an absolute minimum. If the dog normally jumps on the bed, don't let it jump on the bed. But if that is habit, then you've got to get there before the dog does and lift the dog onto the bed.
Assist.
No jumping on and off of couches, no chasing monkeys, no barking at the postman that's coming, because inevitably they're charging up the driveway. So need to explain what we mean by minimize activity. It's not just we're not running today, but in every sense of the word, the dog needs to be kept quiet.
I mean, I was very fortunate when I arrived today. Came in with all my stuff for the day. I saw this gorgeous dog and it was going to have surgery today. And the owners were saying, well, what time can we collect? Because obviously everyone wants to get their dog home as early as possible. And I heard Zanelli, one of our reception staff, say, okay, well, between 2 and 5 is an ideal time for discharge, but we'll notify you. Yes. And she was like, I'll be here at 2. And I said, well, just bear in mind that potentially at 2, she may be a little bit too drowsy to go home.
Absolutely.
So, just wait to hear from us. But, at that stage, she's going to need to be kept warm and things. So, I mean, there is purpose in some of the stuff that we communicate because of, like you say, the surgery that they have, a hysterectomy. That's
huge.
Big. But also because of the drugs that we use in order to anesthetize them. And that can leave them quite sedated and then have a knock-on consequence where they go home and fall down the stairs or whatever it may be, or get knocked by the dogs in excitement.
Yes, yeah.
So, I mean, as a cold day out there today, why do we advise that they're kept warm and quiet during that initial period? Let's talk about our case example of they're going home after being spayed or neutered.
Yes. So when a dog goes under general anesthetic, well, any species really, when you go under general anesthetic, your body temperature, your core temperature drops significantly. So we do everything that we can while the patient is in theatre and recovering from anesthetic. We use a bear hugger, which is a warm air device. We use heated bean bags, blankets. We do everything to keep the patients as warm as possible. But just because of that whole effect of general anesthetic, the temperature drops significantly. So, and it does carry on like that for a couple of hours post-op as well. So it is vitally important to keep them warm, because if their temperature drops below normal or to subnormal levels, that can be very dangerous for that patient. Also just in the sense of coming around from anesthetic, they take longer to come around if they're cold. So then your dog might be groggy for the rest of the day as opposed to being ready in a couple of hours.
Absolutely.
The warmer the patient, the better and the faster the recovery is.
Absolutely. And what is your general advice in terms of feeding when they get home?
So if it is an elective procedure, we do request that the patients are brought in starved, so not having had food since 10 p.m. the night before. So inevitably when that patient goes home, 90% of them are absolutely ravenous. And the idea is shame, I must feed, because the pet will be so hungry. And yes, they will be hungry, but in the same breath, we also can't give them like a massive bowl of food or a full portion, because that body is still in a state of recovery and everything is a little bit slower and sluggish, like the whole digestive system is sort of recovering from the anesthetic as well. We cannot overload it with food. So when you get home and the patient is at least sort of walking around by themselves, a small little meal is safe to give at that point, but certainly not a normal portion. And then a few hours later, another small portion can be given to the patient.
So just sort of split the meals.
Small little meals, a couple of hours apart. We certainly don't need to make up for the day's loss. Rather let them recover fully, small little meals to keep them going. And then from the day thereafter, they will be pretty much back to normal if it is a normal surgery.
Yeah.
The sort of take-home instructions for a digestive tract operation would be completely different. They might have to have certain types of food at much smaller or shorter intervals. just because the digestive tract has been upset by surgery, or we can't expand an intestine too much because, we've got stitches in the intestines. So obviously it would depend on the surgery, but normal surgeries, as in elective surgeries, lump removal, spays, neuters, small meals when they get home, couple of hours apart, and then normal from the day thereafter. But with a gastrointestinal surgery, that we would give quite different take-home instructions for feeding.
And the normal food, or would you be suggesting an intestinal type diet? Do you tend to advise overall that people stick with what they normally feed, no additional treats and sort of fancy foods?
So it is obviously quite a big stress on the body having had a surgery. So in an ideal situation, yes, an intestinal diet for a couple of days would be fantastic, even for patients that have been in a hospital stay for a different reason. It's a very stressful time for the body, and intestinal diets are generally a lot easier to digest and don't have anything that's going to upset the apple cart in the sense of organs taking stress, for example, pancreatitis and all of that. So an intestinal diet is a lot gentler, a lot easier for the body to deal with. And, you can also get away with feeding a little bit less of it and it being a lot more sort of nutrient-packed and easier to digest, so they don't need a lot of it. So then safer for the gut and less
likely to have vomiting or diarrhea as a consequence. Hello, I'm Dr. Cara, a veterinarian and the host of the Paws and Effect podcast. Our show is all about enhancing the lives of pets by providing reliable, science-based advice and engaging in discussions with experts in veterinary medicine, pet nutrition, and animal behavior. As a professional with years of experience in both the UK and South Africa, I run a 24-hour veterinary hospital and an online pet store. I'm also pursuing a master's in animal nutrition and consult for UltraPet, a local veterinary-grade pet food manufacturer. My passion lies in sharing knowledge and helping pet owners make informed decisions about their pet companions. The Paws and Effect podcast is rapidly growing, attracting a dedicated, engaging audience of pet owners who are passionate about their pets' health and well-being. Our listeners trust us for credible, informative content that empowers them to provide the best care for their animals. We are looking for sponsors who share our commitment to pet health and who want to reach a highly engaged and expanding audience. Partnering with us means aligning your brand with trusted and influential content that resonates deeply with pet owners. As a sponsor, you'll benefit from high visibility on a platform that is used for multiple purposes, including educational content, product recommendations, and community building. We offer various sponsorship packages designed to fit your marketing goals and budget, ensuring that your brand gets the reach and the impact it deserves. Join us in making a difference in the lives of pets and their families. Let's work together to bring valuable insights and quality products to our passionate audience. If you're interested in sponsoring the Paws and Effect podcast, please get in touch. I look forward to partnering with you. Before we continue, let's address a critical aspect of feline health, weight management. Allow me to introduce you to UltraPet's special diet, Metabolite cat weight loss food. It is available in 2 kg and 4 kg packs, specially crafted to support your cat's well-being and vitality. This recipe isn't just about reducing weight, it's about promoting healthy weight and management. With 34% protein, 11% fat, and 4% fiber, it helps control lean muscle mass while maintaining a healthy weight, ensuring optimal nutrient absorption. Featuring a tantalizing chicken and rice flavor, UltraPet ensures that even the picky eaters will enjoy their meals. The vacuum-coated kibbles deliver a taste experience that your cats will love. What sets this weight loss food apart is its formulation made with fresh meat, providing a healthier source of protein. Plus, the added addition of taurine supports good eyesight development and a healthy cardiac activity. With omega-6 and 3 fatty acids, this food promotes a shiny coat and a healthy skin. Additionally, the inclusion of VitaCat ensures essential vitamins and minerals for healthy development and immune system protection. The prebiotics in this formula create an environment for microflora to flourish, further supporting your cat's digestive health. UltraPet's special diet, Metabolite, is an ideal choice for overweight cats. Just ask Freya, my Bengal, who has thrived on this diet. Give it a try and see the difference for yourself. Your cats will thank you, and you'll appreciate UltraPet's commitment to feline health. Now, back to our episode. So let's talk about the stitches. So when they're discharged, well, let's talk about the situation where they have a drain, I think, before we even go to the stitches. When they have a drain, often we tend to put drains in where the skin is pulled away from the underlying muscle, or there's muscle damage underneath, and we've essentially got a pocket that could accumulate fluid, whether it be purulent fluid, as putty fluid, or just sort of liquidy fluid for the for the listeners' interest. When we know that it may accumulate, we tend to put in a drain, which will allow this now to drain out.
Correct.
What is your advice in terms of the post-op care of drains?
So, funny enough, we do actually battle with drains in the sense of sort of the patient compliance with the drain. If we're trying to get all that fluid out, it is inherent in them. They are wanting to get to that wound, to lick the fluid. They can feel the fluid. They can smell the fluid. They are so intent on getting to that drain. So first and foremost, all of the patients with drains have to have a buster collar on. And it is not for a torture purpose or anything like that. But, we have a lot of clients feeling sorry for the pet. Oh, shame, I'll just take it off for a minute, let them have a break. But it is imperative for that collar to stay on, because that drain needs to be in there, and it is the first thing that pet is going to go after.
So we're talking about
opportunity.
The cone of shame.
The cone of shame, yes.
So it must stay on.
Must stay on.
Sent home with it, unless they phone you and say, look, I'm really having trouble with this. What else can I do?
Yes, yeah.
We
can make a plan, but there's got to be zero access for that animal to get to that drain.
And that's because they either remove the drain or they lick and they traumatize the area.
Yes, and most of the time when they're actually getting hold of the drain, they sort of like breaking off the end of the drain that we leave outside for it to drain through.
Sorry, I'm just sneaking a cuddle with a cat. She probably won't stay on my lap.
They're actually going for the little end of the drain that's sticking out of the skin. And what the clients will see is like, oh, they've pulled the drain out. But we've actually secured the drain at both the bottom side of the wound as well as at the top of the wound to keep the drain the full length of the wound itself on the inside. So if they've just chewed off the little bottom piece of it, we don't actually know whether the whole drain is still inside, because inevitably the owners don't find the piece that the animal pulled off or the whole drain. So then that turns into another procedure now, where we now have to sedate the patient and go and explore that wound again to see if they'd only actually chewed off a tiny piece of the drain or did the whole drain come out. It turns into...
And you can't go fiddle and prod.
No.
That's painful.
Yeah, exactly. And nobody will tolerate
tissue.
That. Yes.
It has nerves and a blood supply. And the last thing you want to be doing is poking in there. So they need to be sedated.
Absolutely.
So it requires...
And worst case scenario, we have had it before where it's only the day after surgery and we had to open up the entire wound again and start again from scratch, because we had to open it up to get the remnants of the drain out and then start again. So... imperative, the cone must stay on.
Okay. So now to the stitches. I suppose same explanation. You want that cone on, or at least, and I've seen you before, put a cover.
Yes.
So how do you decide whether you're going to cover it or leave it open to the air?
So with regards to the different types of wounds that require stitches, if it is an elective surgery where we've got a very clean, precise incision site that we've done through the skin, our stitches are generally a little bit looser as well, because we don't have any tension on the wound. It's literally we've cut it open and we're stitching the skin back together. So very little tension, very little inflammation in the area, no trauma to the tissue surrounding, as opposed to a traumatic wound like a dog bite or a laceration from a fence or anything like that. Those wounds can have crush injuries to the tissue, lots of inflammation, obviously quite painful for the pet itself. They are then generally attracted to those wounds and want to fiddle with those wounds.
Sometimes even the nerve supply to those areas are compromised, and
can
they feel
be
like
damaged.
pins and needles.
Yes, exactly. And then because we then tend to have a bit more tension in those types of wounds as well, because they're either sort of jagged cuts or we've lost a bit of skin in that area, the stitches can then also be a little bit tighter.
They kind of pull.
Yeah. And it gives a funny sensation for them. So they are then very attracted to that area and are quite likely to pull at those stitches and traumatize the wound further, which we obviously don't want. So hence the the cone of shame, as much as everybody hates it, it is an absolute necessary for the slightly more docile patients that are not going to tear at it. We can get away with a plaster cover. They do seem to then tolerate that a bit better. But not every dog is going to tolerate just a plaster. They'll pull the plaster off and go at the stitches anyway.
Let's talk about the medication that's given on discharge, especially the elective ones where people go, oh, they're fine now, they don't seem to be sore. The importance of continuing or at least asking us if they can discontinue some medication. Because let's talk the dirty wound, because we don't always dispense antibiotics because viruses, but let's talk a dirty bite wound where we're dispensing antibiotics. We feel that it's required, and some anti-inflammatories. And we sometimes find owners don't complete the course. So what's the importance of completing the course of the medication that's dispensed for your pet?
So, big problem not completing an antibiotic course. Antibiotics are designed for treating specific bacteria, and they are designed to be given for a certain time frame to ensure that all of that bacteria has been killed off. If you are using a shorter course or not completing the prescribed course, you are then creating what we call resistance to antibiotics. So not obliterating the level of bacteria that is required leaves it then to sort of double up, and they can multiply and cause sort of a huge mess in the wound. But now that antibiotic that was initially prescribed and that is generally effective against that bacteria then no longer works. And that's been happening for years and years and years. And we will eventually run out of antibiotics that are effective against bacteria. So it is vitally important to complete an antibacterial course at the prescribed level, because that is how it is designed to work and what is required to work efficiently.
Absolutely. Yeah. And in terms of the anti-inflammatories, I suppose I've answered the question a bit, but the painkillers that we prescribe, a lot of people don't see them as anti-inflammatories. They see them as painkillers. And they're like, oh, they're not sore anymore. So I stopped giving the X drug because they're fine. So let's talk about how they actually work and why we say just continue them unless you say, you know what, really there's been some vomiting or diarrhea and there's been a required sort of suggestion to stop.
So as you had pointed out, they are anti-inflammatories. So yes, they are a painkiller essentially, and it reduces pain for the pet, but it is also reducing the inflammation around the wound. And that is a proven fact that the more inflammation we have around the wound, the slower the healing time is of that wound, and we can also introduce different infections into inflamed and irritated tissue. So anti-inflammatories are there to keep everything calm and keep the lid on it, that wound has its best chance and best ability to heal as well as possible. So it's not just for pain, it's to actually control the environment of that wound as well. Also with the inflammation, and that causes a lot of sort of the irritation, the annoyance to the pet itself. So then we have backtracking, we have them more likely to irritate and fiddle with the wound if it is inflamed and angry. So yes, the dog might look absolutely fine that it's not sore, but take your eye off of him for a minute and he's going to have a little lick and a look and a chew and everything because it's itchy and it's red and it's inflamed. So
by the time you return from work, that could be a mess.
Absolute mess. And we have seen them turn into an absolute mess, from the small little wound that we started with a few stitches in. Now they've traumatized the tissue, ripped it all open, the stitches are gone, and they've done more damage to the area than was initially there in the first place. And, sort of unfortunately at the end of the day, once we've discharged patients into the owner's care, that is on your hands, we can't foot another bill for fixing the wound. So that is at the owner's expense to literally redo the surgery, and quite often it's bigger than the first one.
Absolutely.
To fix that.
So the kind of signs you're asking owners to look out for in terms of this wound, so they can visualize it. Hopefully they kept the cone on. I have seen, as a little side note, these cones actually being used to rub. Have you seen that?
Yes.
being used to rub the area. You think,
Yes.
oh, you can't get your mouth there, but they're clever enough
Yes.
to kind of go, oh, this
Use
is
the
a
edge
nice
of the
scratching.
cone. Yeah.
Which is very frustrating.
Very smart
but
dogs.
We can definitely put a bit of padding on that and try and help it or find a different solution.
Yes.
But what are the sort of signs in terms of like what are the main points you say to owners? This is what I need you to look out for and contact me or return if you're noticing.
Yeah. So the first and foremost common signs with a wound that's going south, redness around the area, oozing from the wound, and that could be either blood oozing, a serous clear ooze, or even a pus ooze. Any oozing should be discussed with the veterinary staff. If you're not sure, rather check in. A phone call is free, and we can advise what needs to be done. Also, if there is any strange odor coming from the wound, so any bad smells, weird smells, anything like that, it's not normal and should be investigated. If any of those things are left and not seen to, we could be going down a really nasty path for that wound. Yeah. And the sooner it is picked up and sorted out, the better and quicker the recovery is. We have had cases, where, it smelt funny a couple of days ago, and we sort of think it should be seen to now. And we've lost massive tissue to necrosis because the funny smell was the tissue dying off. And
they're sick. They actually become systemically very ill then.
And, we have had, unfortunately, for example, a leg wound that then ends up in an amputation because that leg wound was left when it was oozing and smelling and not doing well. The dog then had to have the leg amputated because there was nothing we could do to salvage that wound anymore.
So
proactive. It had been left too long. Yeah. So that's important. A drastic example. Yeah. But it does happen. So, rather a phone call, rather check in. It costs nothing. We can advise, send a photo to us. It looks like this. Is this okay? Rather everyone on the same page and get to things quicker if need be.
Absolutely.
Yeah.
I mean, I suppose with the redness comes some heat. We don't encourage owners necessarily to touch. You
can touch around it, but not the suture line itself. Yeah.
And a little bit, of post-operative. But if owners
to
are
be
in doubt,
expected. Yeah, no, exactly. Rather like check. But, if you've got a bright red wound and, sort of all swelling along the edges or anything like that, that's generally not normal. Also, it would be wound dependent on what the wound was. Is it a surgical wound? Is it a traumatic wound? There are sort of, with each wound, expectations and limitations as to
so I suppose that it's a perfect time to talk to you about that post-op check because, like you say, you have an expectation of what it should look like. Yeah. So what is the time frame that you generally ask people to come back after being discharged?
So in some serious cases, we might even request as early as 24 hours. So the very next day we want to see how's everything looking, is everything okay? But in general, it's 3 days. And that would also cover the guys that do have the surgical drains in place. We do generally remove a drain after 3 days. So 3 days is a sort of a general standard for a post-op check. And we should also then know about, is there too much redness? Is there swelling? Is something happening? How is the dog coping?
If need be, you take a temperature.
Absolutely.
And, discuss how much are they eating?
Yeah, are they eating?
Are they depressed?
Have they started eating since going home? Have they not? It's been 3 days, they've not eaten, something's wrong. As I say, in certain cases, we may require you back the very next day to check, and that could be those gastrointestinal surgeries. We want everything to move swimmingly. So if there's any subtle changes in those guys, the sooner the better. But sort of your standard elective surgeries, 3 days post-op is a good time to check in.
And then actual stitches, again, let's assuming that everything's going to plan. What is the time frame from discharge to stitch removal?
So there is a little bit of a window period, and the standard window period is 10 to 14 days. Quite often we do recommend going for the 14 days. 10 would be your absolute minimum. But if it is, a really young, happy, healthy puppy, not psychotic, running around all over the place, 10 days, that wound has probably healed absolutely perfectly, and there's no risk of it opening up or anything like that. But then again, any excessive inflammation or anything during the healing process that can delay our healing. So then that 10-day might be too early. So yeah, generally err on the side of 14 days that we know that 100% that wound is closed. But yeah, once again, if there's been any upsets along the 14-day period, we will extend and extend.
Yeah.
So you might come in at that 14-day period and we say, we're not happy to take the stitches out at this point, it will split open, or it's just not looking quite right at this point for us to take stitches out, and we'll monitor that sort of on a 3 to 5 day period. Come back in 5 days and we'll see what it's looking like.
Now, I do want to talk about bandages, but before I do, before we go down the bandage, because I think it's really critical, because that for me is sometimes really where it goes wrong.
Yeah.
I'd like to talk about the kind of things I've seen you do with our patients here in hospital, where I've walked in, I'm like, what you doing? And it's you've been doing some physical activity with them. So it's some movement.
Yeah.
Explain what you're doing and why you're doing it.
Okay. So yeah, post-op or even post-illness rehabilitation. I'm by no means a qualified physiotherapist for animals or anything to that effect, but it is so vitally important for them to continue normal range of motion for all their legs and all the joints throughout the body. If they are sick, ill, incapacitated because of a broken leg or anything like that, they are recumbent for most of the time, so lying down all day, every day. And yes, we are wanting them to be quiet and not walking around and doing their own thing. But in the same breath, we do need them to maintain the muscle mass that they have, so that when they are ready to get up and move about, that they are actually then able to do so correctly and not injure themselves. In a couple of instances, we have paralyzed patients as well.
You've had great success with those.
Fantastic, yeah. And those guys can be paralyzed for up to 2 to 4 weeks. I think 5 weeks was one of the longest ones we had. And, if we had left that dog to lie for 5 weeks, there's no way that dog's ever getting up again.
No, I mean, circulation, like there's a big science behind why it works, and
absolutely,
it's so important. So when do you generally do you hold on to those patients, for example, and do it in hospital? Is that important then for sort of cage rest in hospital so that you can monitor the progress?
Yes, absolutely. And also for majority of clients, they all have their own jobs and work to go to, so they don't have the time, because it is incredibly time consuming. You're watching those guys permanently. You've got to got to turn them. They quite
Sometimes
often
bladders,
urinate or defecate on themselves. They need linen changes, everything. So they are quite intensive in terms of care. So yes, we do prefer them here, that, I can do it on the hour, every hour if necessary. We can change bedding, get them up, take them outside. We are permanently monitoring those patients. And we have great success with that, and doing a lot of physiotherapy along the way, that they don't lose the muscle mass while their body is not able to do anything. Absolutely. That once the disease process that caused the paralysis, once that is over, the dog is able to walk normally because they've not lost the muscle mass. They carry on as normal. It's actually quite insane to watch it happen.
Yeah, I can imagine. I mean, I'm always delighted when we see those.
I'm
ecstatic. You go home
because
they've been in our care for so long.
Yes,
actually
take their first steps and my gosh, that's my day mate. Yeah.
So to bandages.
Yes.
So when you qualify, and I'm going to set the scene here because this is how complicated it can be, and I'm sure you know where I'm going with this. When you qualify, you're obviously taught by someone how to put on a bandage, and I always everyone prides themselves in their own bandages.
Yes.
which is probably absolutely fine if the same person is doing that bandage. Not always, but it's probably fine if you continue to do the bandage with the same kind of pressure, and you'll go into this now with your answer, I'm sure.
Yeah.
But if you get a bandage wrong or someone applies a bandage incorrectly, and I'm not bad-mouthing owners because, sometimes they're just none the wiser, but that there are reasons why it can go wrong. So take us through, before I give the thing away, take us through bandage care and the importance of correct application first.
So, any and all bandages generally have multiple layers to them. It's not just one layer of crepe or specific type of dressing material that covers a wound or covers a break in the leg or anything like that. In veterinary, all bandages have a minimum of 3 layers. So I'll just go through them quickly. The first one is soft band. So that's basically almost like a synthetic cotton wool layer. So that is for comfort and padding. Depending on what we're bandaging and why we're bandaging, the thickness of that layer depends on what we're treating. So if it's a broken bone, it's a lot thicker. There's a lot more padding. The bandage is on for a longer time. If we're treating a wound that just needs a covering, generally a thinner layer because we are also replacing it more often, but it doesn't need all that padding to keep a leg stable. Second layer would then be a crepe. So it's like a stretchy, elasticated bandage material. That is to give us even and uniform pressure for the length of the bandage, and that has a very specific way of being applied. So going down that little rabbit hole of why not everyone can apply a bandage, it is generally that little layer that can cause a lot of grief. So very evenly distributed pressure is applied from that crepe bandage. And then lastly, we have a covering or a sort of a thicker outer cover of the bandage. This can vary from what we call flexus, so it's also like quite a stretchy synthetic bandage material, but it is just to cover the outside and give it solidity that not everything else is also falling off. Or sticky elastoplast because it sticks to the sticks to the rest of the bandage, and we can also stick that onto a small portion of the patient so that the bandage doesn't slip. But yes, bandages, even within the field, everyone, as you say, is going to like, oh, I feel like I should bandage this patient. I'm going to look after this leg, because bandages can go so wrong. And that can be in all circumstances, not only at home. It can go wrong in a hospital environment as well, just because of the nature of pets being pets. So with all of that bandage material in mind, 2 of those layers actually constrict when they get wet. So pets being pets, they like to stick the bandaged foot or leg in the water bowl, or they will jump in the pool the minute they get home. And quite often we see, oh, Shane, the bandage just got a bit wet, but it's fine.
I've dried it.
Yeah, blow dried it even. And that is honestly the worst situation for that bandaged limb or bandaged area. That bandage material, regardless of how well you dried it or you thought you dried it, or even worse, applied heat, that is constricting, and it will cut off blood supply. 0 wound healing happening under there. Also, if you have a wound under there, guaranteed it is now wet. So you don't have a clean environment for that wound. It is now going to breed bacteria like there's no tomorrow. And things go horrendously wrong with a wet bandage. And even if it's a small section of the bandage, it's not even that the whole bandage has to get wet.
And it draws up water.
Yes.
It's amazing. Like even like you're saying, that little dip in the, I stepped wrong and I stepped into the water bowl.
Yes.
And it's not, you don't always necessarily see it.
Yes.
You've got to refill for them all the time.
Yeah.
But they it may just be them getting up from lying down and suddenly, the foot's wet.
Yeah.
And then it just seems to soak up.
Absolutely.
And inside.
It's like a quick, yeah.
So, that is something that owners need to, if that bandage gets wet, they need to come in and have it replaced.
100% immediately. That bandage will start constricting so fast. It is crazy.
Yeah, not the next day.
No, it's today. It is always at discharge. We say, please, if this bandage gets wet in any which way, shape or form, it needs to come back in for a change. And this is also where a problem does come in, that clients sort of don't want to come in, or I don't have time to go back today, or the dog stood in the bowl for the 3rd time. I'm just going to do the bandage myself. And we do have owners applying bandages, and because they're not trained in it, and as I said, there are very specific ways and lengths of bandage as to how much your overlap is of each type of bandage material. It's not even the same for each layer. It is so particular as to how to get the even pressure throughout that entire bandage that if an owner tries to apply a bandage themselves, and I've seen human nurses trying to apply dog bandages, it's not the same thing. So just rather please go back to the veterinary practice. They are trained to specifically put those bandages on for wherever it is on the pet.
And even if it slips, talk about the slipping bandage.
Yeah.
So it's not wet, it's just...
Yeah. So it happens, once again, if we've told you to please keep the dog and cat quiet at home, sometimes they go zooting down the passage and a bandage could come loose. If a bandage slips, once again, we've had uniform pressure for the different formations of where the wound is, but we've always got a bandage quite high up a limb, for example. You always have to go above the joint that's above the wound itself or where the break is. So the bandage is, yes, quite comically large on animals, but for a reason, and it is to help prevent them slipping, but they can slip. But now if you've taken the width of the bandage that was originally around the elbow is now sort of down around the forearm of the pet, it's not the same width, it's not the same thickness.
Now tight.
Yep. So you could slip down to areas where it is now tight or it's too loose, and all sorts of things can happen. You now have wound instability, bone instability, because now you've got a big flappy part of the bandage around the fracture site.
And then now potentially also constricting
the toes.
Nerves. And I mean, we've seen bandages go so wrong that animals then bite and traumatize their toes.
Yes.
Have you seen that?
Yes.
I mean, you were here, yeah.
Yeah.
I mean, that is just dreadful.
Yeah.
So they then, because they're not sensing, it's like that pins and needle feeling.
Exactly.
They're not
or
sensing.
They've lost all sensation.
Absolutely.
And there's now a front foot that they don't feel belongs to them.
No blood supply.
Yeah.
Nerves compromised.
Yeah.
It's gone from painful
to
absolute nightmare.
Dead. Yeah. And it's an absolute nightmare. And, that makes us queasy to our stomach watching a dog eat its own foot off. And it happens. It is not being dramatic. We see this a lot.
Yeah.
So the importance of bandage care is next level.
Yeah.
Like when we tell you it cannot get wet, it cannot get wet.
Yeah.
For the same instance, I mean, living in KwaZulu-Natal is a lot of fun. You'll have 4 seasons in a day. So, you might have wet grass in the morning, blistering heat in the day, and then a thunderstorm in the evening.
Yeah.
You also can't have that dog walking out on wet grass because, as you say, the crick, it's drawing water into that bandage. So we do often recommend putting a little plastic cover, like a little plastic packet, or we always have reused drip bags, that it's a nice thick plastic. We can make a little slip cover for the animal to go out onto grass to prevent it from getting wet at that time frame. But the plastic covers cannot stay over the bandage going forward, cannot stay on for a few days or anything. It is onto the grass and off again.
Absolutely.
Because that plastic is trapping heat and trapping sweat
Moisture.
within the bandage. Yeah. So you're preventing the grass moisture from getting onto the bandage, but now you're creating your own moisture if you leave that plastic cover on. So it's
a lot to know.
Yeah.
It's a lot to know. And
and
sometimes
very intricate.
It's terrible when people learn
the hard
way.
Yeah.
So I don't want to lose the opportunities because I know we're running out of time. How important is like say good nutrition in healing and in sort of recovery of our patients?
No, vitally important. Important. So just take into consideration everything that a body requires to heal in any which way, shape or form. So being sick with an illness or trying to recover from a severe injury, broken bone, if you have poor nutrition, you don't have the correct vitamins, minerals, levels of protein, if you're lacking in that, if your calcium levels are depleted for whatever reason, you're not going to heal, or you're going to take a very long time to heal. So nutrition is vitally important during the whole recovery and healing process to make sure everything is absolutely at its best
Optimum.
possible. Yeah.
And also it's an indication then of potential signs of illness or deterioration. So if they're not eating and you're monitoring that and then they're not wanting to eat or they're not finishing their food, that could be one of the first things that owners notice. You know, obviously the vomiting and diarrhea is so much easier to, that's so most people. But that kind of, they're not eating all their food, or they're not interested in food. That can always be that kind of red flag too. They're not feeling well.
Can be feeling nauseous, can be feeling pain, could have a fever. There are multiple angles or reasons for why a dog is just not quite eating well after surgery or after a hospital stay.
So just in summary, can you any advice to like the fundamental sort of the big take-home message for owners who are collecting their pets from our care and the sort of things that they may forget to ask us?
So first and foremost, please do adhere to the discharge instructions. If for some reason, if it's not our vet practice, another vet practice, if you are not receiving discharge instructions, please do ask for them. They are discharge instructions for a reason. We are not trying to make everybody's life a living hell. There are very valid and specific reasons for why we request what we request. And it is for the good health of those pets and patients that they recover at optimum, the best possible. If there is anything that you do not understand or you want clarification on, please ask. There's no shame. No one's going to get angry with you or anything for asking questions about what if I see this, or what if it does that, or what does this mean on the discharge instructions, for example, like the mobility, not just not running 5Ks down the road, but we're going to walk 5Ks down the road. Just ask for the clarification. My dog normally does this. Is that okay? Please ask us, because, that might be something vital that we need to know, that your dog's daily habits are actually going to hinder his healing. And then once home, don't be shy to phone, ask, email a picture. Always check in. That's what we're here for. If you can't necessarily speak to the vet that was seeing to your pet, speak to the nurses, speak to the receptionist, send an email. Somebody will take a note. Somebody will get back to you. And if I don't know the answer, I will speak to the vet.
Don't Google it.
Don't Google it. Ever.
There's a lot of misinformation. There's a lot of great information out there, but there is also...
but you also need to know where to look.
The correct sources.
There's a lot of really bad information. There's a lot of really good information. And, we are trained at it. We've done the years in varsity. We've done the research. We have to do continuous sort of studies throughout our career, so we are constantly on top of the new information
and things that used to work, and we're learning. We're becoming progressively better and better, hopefully, at with new advancements both in medicines and I mean, even we talk something as simple as like physio or whatever. We are always wanting to progress. As professionals, and so when we get new information, we really scrutinize it. And, and if it's good, we put it in place.
So we're all learning, but we're doing everything to the best of our ability. So ask us. We're there to help. That's what we're here for.
I love it. So, thank you. Very informative. So. Yes, thank you very much for being our nurse and being
thank you for having me.
Available to answer all those questions. No, it does certainly help, because I know that historically us as vets we're under time pressure, and we don't have or we were not. We're getting better at communicating the kind of things and the kind of language that owners are wanting. You can sometimes, like you said, go, what does that word actually mean?
Exactly.
So we're hopefully getting better at explaining things. But it really helps to have you doing our discharges and monitoring our patients so much better, and all the physio and care that you put into them. It's wonderful. We're very fortunate.
That's why we choose to be nurses.
Thank you, Sister Kara.
Absolute pleasure. Thanks for having me.
Thank you, Sister Cat, for sharing your experience and offering such practical, invaluable advice for pet owners dealing with post-op care. We've covered everything from wound management and cage rest to the importance of follow-up checks and nutrition. For anyone listening, remember that post-op care is just as important as the surgery itself. By following the right steps, you're giving your pet the best chance for a full recovery. Thanks again for joining us, Sister Cat, and until next time, take care of yourselves and your pets, but don't forget to give them a big hug from me. Be sure to subscribe to the Paws and Effect podcast for more tips on how to care for your pets from experts like Sister Cat. Have a post-op recovery story or question? Drop us a message and we might discuss it in our upcoming episode. Don't forget to follow us on social media for updates and more practical pet care advice. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.